Welcome to The Spine Guide. The Spine Guide is a channel dedicated to making the complex spine simple for patients to understand. On a prior video, we talked about where SI joint pain comes from and how to diagnose it. Today, we'll be talking about some of the non-interventional ways to treat SI joint pain, particularly during the acute period, which is in the first 6 weeks. As a reminder, SI joint pain usually comes from either arthritis in the SI joint or tear in the capsule around the SI joint, and it's usually point tender around this joint. What I usually tell patients when they have acute SI joint pain is that you need to take the inflammation off of the joint. So the first thing to do is to avoid the activities that cause pain in the SI joint. It's pretty simple. If it hurts you, don't do it. But because the SI joint is really susceptible to something called shear force, which is that force that goes up and down, any activity where there's lots of pounding can increase stress on the SI joint. So this includes things like lunges during yoga, bicycling, doing hills or hiking, etc. Really just walking on flat surfaces is the best thing for the SI joint. Also, something that can be done is medication, which is an anti-inflammatory medication to take inflammation off of the SI joint. These are typically called NSAIDs, NSAIDs, which stands for non-steroidal anti-inflammatory drugs. The most common one is ibuprofen, so the brand name is Motrin or Advil. When I tell patients to take ibuprofen, we usually tell them to take very high doses constantly for a short amount of time, so it actually has time to reach a baseline level in your blood to work. So typically I would say it's anywhere from 600 to 800 milligrams of ibuprofen, so that's 3 to 4 200 milligram tablets 3 times a day for 10 days straight, like an antibiotic. And again, the idea is that it delivers a constant baseline of medication. The other medication you can take is naproxen. The brand name is Aleve. So for naproxen, it would be 2 tablets twice a day for 10 days. Now, both the ibuprofen and the naproxen should be done only under the direction of a doctor. These are higher doses than are normally stated on the package. And so a doctor really needs to monitor your kidney function, needs to ask you about your GI function. And we will typically, along with these medicines, also prescribe some anti-acid medications like Pepcid or Prilosec that's also over the counter. For patients that really have GI issues or gastrointestinal issues as a result of anti-inflammatories, we also can use a drug called Celebrex, and that's always a prescription medication. That's not over the counter. Some patients want to take Tylenol. If you want to take Tylenol, it's 1 gram every 8 hours. I would not do more than 4 grams a day. It can cause liver toxicity. And Tylenol in general is not as good as an anti-inflammatory, so I would ask patients to shy away from Tylenol for inflammation-based issues. Narcotics like Norco or Percocet really tend not to be as useful for inflammation, and muscle relaxants also tend to be less useful. There are drugs called Neurontin, which is the same as gabapentin. It's a nerve medicine. Those nerve medicines are good for sciatica, which is buttock and leg pain, but really not so good for inflammation around the SI joint. Some of the other things that might help you for acute pain is stabilizing the SI joint. So the SI joint is sprained, and to stabilize it, you really want to be able to stabilize in a cuff around the SI joint. So there is something called a trochanteric belt or an SI joint belt. I'll show you one here. So this is an SI joint belt that you can purchase online. And the one that appears to be the most popular, most common, and has a little bit of research around it is something called the Sacroiliac belt. So you can just get this off of Amazon. I am not a paid consultant for Sacroiliac. This video is not sponsored by Sacroiliac. And in fact, I would say that the box for the Sacroiliac belt, and this was made by a chiropractor, makes certain claims that really just aren't true. The first is treating sciatica, so I do not think this should be used for sciatica. SI joint dysfunction, I think it is useful for SI joint dysfunction. Disc herniation, nope. Hip degeneration, nope. Lumbar canal stenosis, nope. Pubic symphysis dysfunction, probably not. And facet joint syndrome, definitely not. So in my mind, the only place for this kind of trochanteric belt or SI joint belt is really SI joint dysfunction. And again, the idea is that it wraps around what's called a trochanter. So if this is the hip, this is the trochanter. So the belt actually sits quite low, and it has to sit right in and around the trochanter. So you essentially take the belt, center around the low back and also around the trochanter, and then cinch it out in front. The best guideline for where this should sit up down is it's slightly below your belt line, and the bottom of the Sacroiliac belt on the front should sit right at the hip crease. So when you flex your hip up, the bottom is right at the hip crease. And again, this is meant to help stabilize the SI joint temporarily. I typically tell patients to try this for 2 weeks, probably no longer. If it's not helping, it's probably not going to help. You should wear it when you're up and around, bending, lifting, twisting, and walking. You don't really have to wear it in bed, but it's certainly something to try. The data is very limited in SI joint belts. In my mind, I think it causes very little harm, so there's no reason really not to try it. If after the acute period, after 1 to 2 weeks, you're feeling a little bit better, I do think that physical therapy is a good thing to really try and to prevent SI joint pain from happening again. Physical therapy works on core strengthening and strengthens the muscles around the SI joint. And I do think that is something that can be very useful. So here we are with Jamie, my favorite physical therapist, who's going to show us the 3 best exercises for SI joint dysfunction. These are all meant to strengthen the muscles around the SI joint. We're going to talk about the glute bridge, the side plank, and the bird dog. So take it away, Jamie.
Okay. So first up we have the glute bridge. You're going to lie on your back, feet hip width apart, and you want your feet relatively close to your butt as opposed to farther out. So bring your feet close to your buttocks, weight on the heels, and you're going to tighten your glutes, push through your heels, squeeze, lift to the top, hold for 2 seconds, and then come down slowly and tap the mat, and then squeeze the glutes and control the release. And you're going to do 15 repetitions, 2 sets.
So 2 sets of 15, 30 total.
Yes.
Okay, and then let's move to the next one, which is side plank.
Okay, so this is a modified side plank. You're going to have knees bent, arm bent, elbow under the shoulder, and you're going to push through your elbow and forearm and your knees, lift your hips up, and then lift your arm up, and you're going to hold that for 30 seconds, and then come down slowly after 30, and you're going to do 2 sets of 30 seconds on each side.
And then our last one is going to be bird dog.
Okay.
By the way, why is it called the bird dog?
No idea.
Nobody knows. Okay.
I'm sure something about the shape of your body is animal-like, but I have no idea.
Okay.
Hands go under the shoulders, knees go under your hips, and head is in neutral, so you're not bent down, your head's looking straight ahead. And you're going to engage your abdominals, and you're going to straighten your right leg and your left arm.
So opposite arm and leg.
Yep. And come back, and then alternate. Right arm, left leg, and come back. And the idea is that you're reaching forward as opposed to up. So it's not about arching your back. You're working your core to prevent your back from arching and to stabilize while you're balancing. And you want to move nice and slow. And it's not about how high you get. It's just about going slow and controlling the movement.
Okay, and how many do you do on each side?
10 on each side, twice.
10 on each side, so 20 total, twice.
Yep.
Okay. And then how often do you want to do these exercises for the SI joint?
Once a day.
Once a day, all right. Okay, well, thank you very much, Jamie.
Thank you.
So hopefully you learned something about some of the truly non-interventional ways to treat acute SI joint pain when it first comes on. In our follow-up video, we will be talking about some of the more interventional ways to treat this, including the use of injections and ablations.